If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, what are the types of diabetes? Answer by Sachin Kadam. As per the inner mechanism, diabetes can be broadly categorized into following three types. Type 1 diabetes. Type 1 diabetes, also referred to as juvenile diabetes, is commonly diagnosed in children as well as young adults. Only 5% of the people with diabetes are suffering with type 1 diabetes. Type 1 diabetes occurs when patients' own immune cells destroy pancreatic beta cells, and hence patients with type 1 diabetes often have to deal with zero or insufficient production of insulin, which in turn can limit transportation of glucose to different cells of the body, forcing them to accumulate in the blood. Following measures can be offered by your practitioners in order to manage your diabetes. Type 1. Type 2 diabetes. Type 2 diabetes is often experienced by middle-aged and older people. However, overweight and sedentary lifestyle can as well be some of the triggering factors. It usually begins with insulin resistance. In other words, fat, muscle, and liver cells do not use insulin to carry glucose into the body cells for energy production. Basically, the pancreas keeps up with the added demand by making more insulin, which in turn results in less amount of insulin when blood sugar level is increased, such as after meals. If this is being persistent, you need to get an appointment with the doctor. Other than that, you can treat type 2 diabetes by. The third type of diabetes is quite understood by its name, that is gestational diabetes. Only pregnant women experience this type of diabetes. They produce hormones that result in insulin resistance. This is evident in all women late in their pregnancy when insulin production is down, but overweight or obese women have higher chances of gestational diabetes. It is also to be noted that gestational diabetes can also develop due to too much weight gain during pregnancy. As only pregnancy leads to insulin resistance in this type of diabetes, it usually goes away after the baby is born. Although, a woman who has had gestational diabetes can suffer with type 2 diabetes, possibly later in their life. Also, babies born to mothers who have gestational diabetes are also more likely to grow obese with type 2 diabetes. Currently, insulin shots or certain steroidal medications are offered as a diabetes treatment. However, it has been evident that the treatment cannot alter the disease progression, nor can it alter the damage that has already done, but can only slow down the advancements. Additionally, long-term exposure to steroidal medicines as well as hormonal therapy can lead to other complications. Apparently, an alternative therapy is always in demand by medical professionals as well as patients suffering from the disease to reduce drug dependency, alter the damage to some extent, as well as stop or slow down the progression. It is always advisable to manage your diabetes, as being constantly exposed to higher glucose in the blood can cause serious health issues. However, with scientific advancements and upgraded medical technologies, you can always opt for a cost-effective alternative solution to the conventional treatment regime. Furthermore, chronic diabetes can as well delay quick healing from any injury, which can easily lead to removal of a damaged toe, foot or legs, etc. Answer by Nandu Songlikar. What is diabetes? Diabetes is a chronic, often debilitating and sometimes fatal disease, in which the body either cannot produce insulin or cannot properly use the insulin it produces. Insulin is a hormone that controls the amount of glucose, sugar, in the blood. Diabetes leads to high blood sugar levels, which can damage organs, blood vessels and nerves. The body needs insulin to use sugar as an energy source. What is the pancreas and what does it do? A pancreas is an organ that sits behind the stomach and releases hormones into the digestive system. In the healthy body, when blood sugar levels get too high, special cells in the pancreas, called beta cells, release insulin. Insulin is a hormone and it causes cells to take in sugar to use as energy or to store as fat. This causes blood sugar levels to go back down. What is type 1 diabetes? Type 1 diabetes occurs when the immune system mistakenly attacks and kills the beta cells of the pancreas. No, or very little, insulin is released into the body. As a result, sugar builds up in the blood instead of being used as energy. About 5 to 10% of people with diabetes have type 1 diabetes. Type 1 diabetes generally develops in childhood or adolescence, but can develop in adulthood. Type 1 diabetes is always treated with insulin. Meal planning also helps with keeping blood sugar at the right levels. Type 1 diabetes also includes latent autoimmune diabetes in adults, LADA, the term used to describe the small number of people with apparent type 2 diabetes who appear to have immune-mediated loss of pancreatic beta cells. What is type 2 diabetes? Type 2 diabetes occurs when the body can't properly use the insulin that is released, called insulin insensitivity, or does not make enough insulin. As a result, sugar builds up in the blood instead of being used as energy. About 90% of people with diabetes have type 2 diabetes. Type 2 diabetes more often develops in adults, but children can be affected. Depending on the severity of type 2 diabetes, it may be managed through physical activity and meal planning, or may also require medications and/or insulin to control blood sugar more effectively. What is gestational diabetes? A third type of diabetes, gestational diabetes, is a temporary condition that occurs during pregnancy. It affects approximately 2 to 4% of all pregnancies in the non-Aboriginal population, and involves an increased risk of developing diabetes for both mother and child. What are the complications of diabetes? Having high blood sugar can cause diabetes-related complications, like chronic kidney disease, foot problems, non-traumatic lower limb, leg, foot, toe, etc., amputation, eye disease, retinopathy, that can lead to blindness, heart attack, stroke, anxiety, nerve damage, and erectile dysfunction. Men. Diabetes-related complications can be very serious and even life-threatening. Properly managing blood sugar levels reduces the risk of developing these complications. Wikipedia has been referred to while answering this question. Answer by Kunal Sharma. What are the different types of diabetes? Diabetes is a group of diseases in which the body either doesn't produce enough or any insulin, does not properly use the insulin that is produced, or a combination of both. When any of these things happens, the body is unable to get sugar from the blood into the cells. That leads to high blood sugar levels. Glucose, the form of sugar found in your blood, is one of your chief energy sources. Lack of insulin or resistance to insulin causes sugar to build up in your blood. This can lead to many health problems. The three main types of diabetes are: causes. What causes diabetes? Type 1 diabetes. Type 1 diabetes is believed to be an autoimmune condition. It happens when your immune system mistakenly attacks and destroys the beta cells in your pancreas that produce insulin. The damage is permanent. What prompts the attack is unclear. There may be both genetic and environmental components. Lifestyle factors aren't thought to play a role. Type 2 diabetes. Type 2 diabetes starts as insulin resistance. This means your body can't use insulin efficiently. That stimulates your pancreas to produce more insulin until it can no longer keep up with demand. Insulin production decreases, which leads to high blood sugar. The exact cause is unknown. Contributing factors may include genetics, lack of exercise, and being overweight. There may also be other health factors and environmental reasons. Gestational diabetes. Gestational diabetes is due to insulin-blocking hormones produced during pregnancy. This type of diabetes only occurs during pregnancy. Learn more. What you should know about pre-gestational diabetes. Symptoms. What are the symptoms? General symptoms of diabetes include: type 2 diabetes can cause dark patches in the folds of skin in your armpits and neck. Since type 2 diabetes often takes longer to diagnose, you may feel symptoms at the time of diagnosis, like pain or numbness in your feet. Type 1 diabetes often develops more quickly and can cause symptoms like weight loss or a condition called diabetic ketoacidosis. Diabetic ketoacidosis can occur when you have very high blood sugars, but little or no insulin in your body. Symptoms of both types of diabetes can appear at any age, but generally type 1 occurs in children and young adults. Type 2 occurs in people over the age of 45. But younger people are increasingly being diagnosed with type 2 diabetes due to sedentary lifestyles and an increase in weight. How common is diabetes? About 29.1 million people in the United States have diabetes. About 5 to 10% of people with diabetes have type 1, while 90 to 95% have type 2 diabetes. The latest figures show that 1.7 million adults were newly diagnosed in 2012. Another 86 million are thought to have a prediabetes. But most people with prediabetes don't know they have the condition. Prediabetes occurs when your blood glucose is higher than it should be, but not high enough to be diabetes. About 15 to 30% of people with prediabetes will develop type 2 diabetes within 5 years. You're more likely to develop diabetes if you have a family history of the disease. Other risk factors for type 2 diabetes include complications. What are the potential complications? Complications of diabetes generally develop over time. Having poorly controlled blood sugar levels increases the risk of serious complications that can become life-threatening. Chronic complications include type 2 diabetes may increase the risk of developing Alzheimer's disease, especially if your blood sugar is not well controlled. Complications in pregnancy. High blood sugar levels during pregnancy can harm mother and child, increasing the risk of